And a warning from doctors this morning, as well as the push for COVID-19 antibody tests grows. Some worry that these tests may give a false sense of immunity. Our KARLA NAVARRETE is joining us live for us this morning to kind of sort through all of the myths for us. Good morning, KARLA.
Yeah, good morning to you, Justin. There is definitely a lot of information out there. So this morning we're talking to Dr. Susan Wilder, and she's going to give us a little bit of information and clarify some of these myths that are out there. Dr. Wilder, thanks for being with us this morning.
Thank you.
First off, who should be getting an antibody test and who shouldn't?
Well, I think a lot of people want some information. The ones that really should consider getting antibody testing are those who are in high-risk contact with potentially high-risk patients. So they're living in a home with a patient who's got chronic medical problems or elderly. They're caring for the elderly. They're healthcare workers. These are our first priorities to test for asymptomatic exposure to this virus.
And we've been talking a lot about the asymptomatic person. We know that they are, Dr. Fauci at the national level mentioned the other day that he believes there are quite a bit of numbers of folks like that. And so can you elaborate a little bit about that, the asymptomatic carrier?
Right. So what we've been doing antibody testing through a very well-validated lab for about a month, and we're finding a pretty high percentage of patients, at least 3 to 5%, who are testing IgM or IgA positive, meaning they have evidence of recent exposure within the past 5 to 7 days, and those people are potentially infectious. We can't know for sure, but out of caution, we would recommend at least a 7-day isolation period, and my hope is that is going to save lives.
And the hope is that this antibody test eventually gets pushed further and it's a little bit more accurate with the FDA's approval.
Right. I mean, we have a spreadsheet of 200 labs right now that, and 120, I think, have applied for emergency use through the FDA. The lab we chose does a much more comprehensive list of antibody testing. So they're testing for 12 antibodies instead of 2. And their entire expertise is in antibody testing. We've had experience with them for many years. So although their FDA EUA is still pending, we felt that being that comprehensive was really important because we're also learning as we go along.
Thank you so much. Yeah, we're going to have Dr. Wilder a little bit later again this morning. She's going to talk to us about what to look for in that lab, how to decipher and figure out what lab is authentic and should be vetted, and which one you should definitely stay away from, stay clear from. So again, we're going to have her a little bit later on in the show, again, trying to give our viewers a little bit more information as far as COVID-19 and this antibody test that has definitely been out there for the public to use so far. So again, we're going to bring you that information later on this morning. Back to you guys in the studio.